Hello, doctors, students of homeopathy, and lovers of homeopathy. Let's begin the session with a silent prayer. Thank you, everyone. So, today is the 1763rd day of the uninterrupted daily webinar of International Forum of Promoting Homeopathy. IFPH is conducting 3 sessions every day from 7:30 to 10:30 p.m. The recording of the sessions is getting uploaded on the very next day so that who missed the session can watch it and get advantage from this session. You can also subscribe the channel without paying any money and share this with your family and friends. So now today our guest and speaker is Dr. Sivendra Kharari. He is an MBBS and BHMS. He is doing practice and research in homeopathy and drug energy transmission. He is on the path of learning and practicing homeopathy for the last 24 years. He is also running a homeopathic hospital. He is already presented in both our Hindi and English session of IFPH stage. So he is already a member of this forum. So today's topic of his session is a case presentation on sulfur. So now I proudly welcome and request Dr. Sivendra Kharari to begin the session and share your knowledge with us. Thank you, sir. Sir, welcome, sir. Now mic is yours. You can present.
Thank you, Dr. Shruti. I'm very happy to be again with you all. Today is a day when I am repeating the thing that the case presentation of sulfur is a repetition of the Hindi one, because I have left my laptop in my clinic, and the same laptop from which I presented last time. I am explaining it explaining it for the English audience. So I'm sorry for that. And this revolutionary case report. I am saying that this is the case report. This is a story that is very true, 100% true, and it is a life-changing story for me, life-changing case history for me. So it's a very inspiring one. So revolutionary, I am saying that the patient who came some 5 to 6 years back, he was a 30 years old male. He was a medical professional, doctor by profession. He was married since 5 years. He was a non-smoker, non-alcoholic, and he was a struggler at the most. He was in a very precarious state of mind, because he was ready to leave his original profession and trying for something else. He was changing. He was on the verge of changing his profession. So how he presented, I want to explain to you that he presented with the upper abdominal pain off and on a daily basis since 1 month or 2 months. It was getting more and more, and it always gave a warm drink, always gave amelioration. He was very much intolerant to hunger, because in other words, you can say he was getting hunger pain. Due to hunger, he used to get weakness, mild aching pain abdomen, aching leg. Other complaints were aching leg. Occasionally used to get cramp. Only after walking for 50 meters or 100 meters, he used to get cramp. Very easy fatigue he used to get. He, at the first preference, he preferred to lie down in the bed or in the sofa. He was called very lazy man. Low grade fever was sustaining since long time. He was having diabetes since 2 years, and bronchial asthma he was having. Mm, Still, it was going on, but it was from last 17 years. Family history was that father was having cervical spondylosis and fistula in ano. Mother was having hypothyroid. Dadi bronchial asthma. Dada enlarged prostate, and both were dead. And one younger brother was having maxillary sinusitis. What actually happened? What actually happened with the patient? Sudden hemorrhage from anus. 2 years back, there was a sudden hemorrhage from anus, massive hemorrhage. He was detected to have hemorrhoids. He went into the local hospital that's called IGIMS, and he was diagnosed with having hemorrhoids, and it was bleeding profusely. But he refused injections and operation on the operation table. 2 years back, this story is of 2 years back. At the same time, he was having attacks of fever, maximum 103 degree Fahrenheit, with headache and followed by pain abdomen. Repeated blood tests revealed diabetes. But the first time he knew about his diabetes, and when the blood sugar was around 200 and blood sugar PP was about 370, he was having very much elevated SGPT that was equal to about 1450. That is too massive. And his bilirubin was 7.2. Ultrasonography revealed coarse liver, fatty liver disease grade 4. But these all things happen in a quick span of time. Quick span of time. And that was the time when he was on the verge of changing his profession. That event created panic to the patient. Patient cried and wept after viewing the reports, blood reports, pathological reports. He was having diabetes mellitus. He was having hepatitis. And before that, that was on the base of bronchial asthma. So he was very much confused that what will be the course? What will be the course? What will be the diet? On the one hand, when the liver was damaged, severe hepatitis was there. He was supposed to take a lot of carbohydrates. And the other hand, he was having elevated blood sugar, diabetes mellitus. It was diagnosed after glucose tolerance test also. So he was supposed to avoid all those carbohydrates and all. So he was in a complete disarray. So he had just decided to shift his career, a very new and challenging venture he was going towards, and it was an unknown terrain. He was not knowing what will happen, but he had taken a decision. You can say the decision was a bit of thoughtless one. He was not. He never pondered. He never took advice with someone. He just took a decision and went ahead. He was not apprehensive or afraid of changing profession. You can say that he was a kind of defiant person. He was a very confident person that he will be succeeding. But it was a decision without much desired plan. So according to me, it was a hurried and thoughtless and impractical decision. So, past treatments, history of the past treatments, I would like to say you that for bronchial asthma, he knew that it was incurable. All allopathic literature say that the bronchial asthma is incurable. Never tried for cure and took allopathy when it was required. So he took corticosteroid, he took bronchodilators, he used to take antibiotics, recurrent doses of antibiotics he took. For hemorrhoids and bleeding, per rectum was gone in a month with some homeopathic medicines and diet restrictions. How did it happen? He was not sure, but it went away. Other presenting complaints did not alter, despite the medicines like Yodelay, Versofac, and other liver medicines. SGPT and bilirubin got down as a natural course of disease. Slowly it got down. You know that the liver is a very strong capacity of regeneration, and it happened, and he accepted in that way that it had to get down. Acute hepatitis had to get down, but his complaint did not subside. All those pain, stomach pain, abdominal pain, crampy pain, low grade fever, that never subsided. And the patient decided not to take allopathy for diabetes mellitus. He was given many tinctures for liver with partial relief. Many homeopaths, including some great stalwarts from Patna, Mumbai, Kolkata, treated him with no avail actually in last 2 years. Cheap medicines were given were Lycopodium, Calcareaca, Nux vomica, Stramonium in different potencies. But the patient suffered. After transient relief, some short-lived relief, it again came back. It kept on persisting with the patient. Patient was frustrated with the no response and expenditure as well as wastage of time. So he was a very aggrieved person at that time because he was in pains. He was referred to Sir Gangaram Hospital, New Delhi, and the punch biopsy with the staple gun of the liver was taken, and that revealed moderate to severe degeneration of liver, plenty of necrotic cells, and he was diagnosed having severe NASH, non-alcoholic steatotic hepatitis. And when his spleen was slightly palpable, cirrhosis was concluded. A few doctors concluded cirrhosis, and few were confused that the spleen can be spleen enlargement may have been pre-existing. So diagnosis, allopathical diagnosis was cirrhosis, or you can say pre-cirrhosis, diabetes mellitus, and bronchial asthma. After 6 months, getting fed up by no response and wasting of time and money, he was told at Gangaram Hospital to get treated at some Ayurvedic or homeopathic centers, as there is no cure. The patient asked about the cure. There is no cure of fatty liver disease, means severe NASH, cirrhosis, or diabetes mellitus or bronchial asthma. All three diseases had no answers in allopathy. So patient visited me for treatment with his wife. He was called twice to be scanned homeopathically. Patient had strong desire. As his wife explained, patient had a strong desire to remain in bed, getting leg and body rubbed or massaged most of the time. During sleep, fearful waking from sleep due to dream of death. Usually he used to dream about death. Some varicose vein were visible in his leg. He was a very lazy, postponing everything to the next day. He wanted to acquire a lot of knowledge. He wanted to do a lot of things, but he was not that kind of ambitious to be the best and all. He wanted to be a very superior personality. He wanted to have a lot of things, had a lot of knowledge. He wanted to have those things. But his that this the way we are seeing that competitive ambitions were missing. He used to read a lot, listen music a lot, giving advices for free. It was his habit. I had observed that the nails were not crippled, not formally dressed, but looked bright and very intellectual. Brushing teeth, bathing, when we probed about him, but brushing teeth and bathing regularly was not in his menu. That was explained by his wife. And she was frustrated that she was married to a doctor, and this doctor is so indisciplinary about his daily routine. The mental features, what I observed, she was a very sharp person, very clear headed, tons of ideas, abundant plannings for ventures. Suddenly he will come up with a lot of ideas, very realistic ideas, but he he was not able to adhere with it till it reaches destination. But so many times he never reached his destination, and this A habit was since his childhood, since all through his academic career. The serious effort was only in the last moment. So last minute reader, last week reading and going to the exams were his habit. So he used to lag behind a bit. So, so many times he failed to get distinctions, gold medal. Much before the exams, more in a complacent and theorizing mode. Before, much more before exams, he used to be in very complacent mode. So no, I know a lot of things. The things will happen. It will take care of him. At the last moment, I will just surpass everyone. And in the childhood state also, in the adulthood state also, when he was in the higher secondary and secondary school, other than his subject, he used to read a lot of things other than his subjects. Suppose he is pursuing science, physics, chemistry, and biology, but he was busy in reading sociology. He was busy reading economics. He was busy reading geography. He wanted to be a doctor, but at the same time, he wanted to be an civil servant. He was that kind of person. That kind of person. So what happened that the concentration, the focus used to shift quickly. So many times there was shifting of focus. He had anxiety of others, family, society. He used to talk a lot about the malpractices in the society. He used to talk a lot about the injustices in the family and the society. And he would come up with some ideas also how to resolve it. He was having fear of death, fear of high places, fear of snakes, depth of water, earthquake, natural calamities, world war. Once upon a time, he was very much fascinated by the prediction of Nostradamus, and he used to be afraid of that and used to think about the solutions, how to avoid the third world war and all. So this was this kind of personality he was. His memory was good. He was very well oriented. Uh, he was very much willing to get rid of his health issues and pursue his next ventures. And but when we probed into the history of the patient, he was a postponer. Just now I explained that he was postponing everything to the next day or week or next year, something like that. He was never a very serious man about future, and not ambitious. Ambitious means he was not very much clinical ambitiousness was not there. Competitive ambitiousness was not there. He had the ambition for himself. He wanted to be getting better each and every day. Not he was having a competition with some other in his own field or in his own subject and all. He was a very lazy man because he used to get whatever venture he used to do, he used to get tired of soon, and he needed support. He wanted someone to help him to go along, and he was very much lazy since childhood. He's never used to walk on foot for long distances. Always he would be needing a vehicle, some transportation mm, to travel. He was fond of music, singing, sports, habit of reading different subjects, fictions and all. Lot of science fictions he used to study. He had lot of great genuine plannings, but it always used to be in his mind or paper. Very rarely used to surface. He had lots of thinking about the society, welfare of the society in his own way. He has a lot of planning. He used to discuss with his wife, his friends, his family, and his colleagues. Spiritually, he was inclined. He was believing in God. He was believing in a power, but he never tried to be very much inquisitive about it. He never went for the meditation, depth meditation. He never do, and he never did rituals also. He did rituals only during the crisis state. Someone is dying, some misfortune is happening. So he was believing in God, but he was not exactly sure about how to attain God. That was according to him. He explained. Mind features are there. He was very angry, used to get angry very easily, used to tremble in anger, used to throw the things. He used to make air castles, theorizing, dreaming, imaginations. So many imaginations were there. Since his childhood, he used to do like this. He wanted to become like Gavaskar. He wanted to become like Tendulkar, winning Nobel Prize, topping the class, topping the universities. He topped the class once, but needed more than intelligence to achieve other dream goals because you need perseverance. He was not having that perseverance, he was lacking that perseverance. And he was very knowledgeable since childhood, great general knowledge. He has a great literature. He could have write poems, he could write some prose stories, and he was a great lover of science, arts, everything. He has a wide range of subjects to follow. And slowly, at his knowledge build up, as his status grew up, he started thinking that he is a very better person. He is the best person. Very few persons are better than me because he has acquired the knowledge. He has a lot of knowledge. He has a lot of ideas, and he performed well so many times. Although some missions were not accomplished, but this was a symbol. This was a scene of a strong ego, strong selfishness, and on the basis of that he became contemptuous also. He used to contempt others, a kind of superiority complex. When he was in positive growth phase, and just like you know that the sulfur people, they always these kind of sulfur people, they are always proud of himself. They think that they are better than anyone, very assertive, very assured about their identity, and they remain very happy. And actually, when you see the larger picture, when this see from the panoramic view, that the people will not be believing that he is that. What he is thinking, he exactly not like that. So that is a kind of foolish happiness. He was happy, but he used to be foolish. That is called foolish happiness. He had his own theories, very affirmative theories about life and death, afterlife, what will happen. A lot of presumption, light of hypothesis, creation, spirituality. He used to give his point. Since 10 years, he started feeling of not looking smart or appearing normal because some people has already criticized him. They started criticizing that he has a kind of self introspection, that he started thinking like that. So he started shying away from the brighter people, smarter people, handsome people, and all. So some kind of, see, that superiority complex was overpowered by inferiority complex in certain aspects. while during medical education, we know third year syndrome, what it is. The third year syndrome he was having during his medical days. Did never respect time. Time he never respected. Only one thing he did not respect was the time and situation. So the his achievement were less deserving. What he was deserving, he did not achieve that. He was such a bright person. He was such a strong IQ, intelligent and smart person. So many times he used to get distracted from his original course. Just explained it before that studying history and sociology during intermediate, leaving his medical profession, taking up different professions, some indefinite things, indefinite job. But their definitivity is not there. Certainty was not there. So he followed some targets which were not certain, was not certain to yield. It was not definite. So he moved towards indefinite. Okay, this was his mental picture. His physical picture, what we observed and listened to him. Uh, he was having shortness of breath. That SOB is for shortness of breath on exertions. Frequent attacks of breathlessness with rhonchi, wheeze, when least exertions used to aggravate. He was unable to go to even the attached bathroom. His roommate used to give him warm water, some pails. Only then, with the support of his roommate, he used to go to the attached bathroom. So many times he got attacks of status asthmaticus. So many times. He used to later on he was not in the it happened in the beginning, but later on he used to know that this is bronchial asthma, and he started taking corticosteroid and bronchodilators on the regular basis, and the corticosteroid and antibiotics on the occasional basis, and used to get aggravated more in the winter season. His abdomen and liver was enlarged after inspection and percussion, auscultation, everything I did. He was having pain on the right side of the abdomen. You used to be very paroxysmal. That was a liver pain, and it was very tender. He never told that it is tender, but on palpation, it was very tender. Left lobe was grossly enlarged, and his all abdominal pain used to get ameliorated by the warm drink since last 2 years constantly. ठीक है तो dream food and perspiration. Dream just in the presenting complaint we used to say that he used to dream a lot, very frightful dreams, nightmarish dreams, dream of death, missing trains, falling from height, dying and all. Food means chocolate desire. He was having strong chocolate desire. He used to take a full chocolate full in the pocket and used to eat, even in the adulthood, even after he graduated in the medicals. Fatty food he loved, sweets he loved, always craved for warm drinks, and it ameliorated also. Hot tea and milk, he always used to take it very hot. Egg was his very favorite food, and he was having a lot of perspiration from his scalp, and especially while eating, and his perspiration was offensive, and his socks used to stink a lot. Head and skin, when we probed, just because I have already told you that this is a case of sulfur, when we probed his childhood, he revealed that he has a lot of head lice and the bed bugs, body lice. He had the history of that thing. History of bioderma was there. Some pustules, recurrent pustules he was having with antibiotic injections, namely injection Panidure. He had taken a lot of. He told me that he took at least 50 injections of 50 vials of Panidures for his pyodermal infections. He was having history of inferiority complex about his appearance in the childhood also. When he used to apply a lot of powder, talc, cream and all, he used to wear a lot of fancy dresses and all to look good and to hide his weak spots. And he was a he was having strong aversion of taking bath. His father was an officer, and his peon used to chase him down and catch him and put him into the trunk of water and wash him. That was the kind of aversion to bath. He was having heat and soles and feet. He always kept it out for cover, even in the winter. Seasonal influences was there. Bronchial asthma used to get aggravated in winter. But one thing I wanted to say that he always tried to hide his problem of asthma even after marriage, just because people will come about know about him and will tell that you are a doctor and suffering from asthma, and he used to hide that kind of that information. Otherwise, except attack of asthma, he used to tolerate winter and summer extremes very well. He was having no chilliness and coldness in the bone and all during winter, and he used to tolerate hot suns and all because he was from Bihar. Bihar is a warmer state, and he used to tolerate all those things. He was having an open air desire, but during illness, he was very much indifferent to it because he used to lie down in the bed, and he never wanted to move. And the next step was analysis based on organ specificity, right-sided affection of the liver. Liver is mainly a right-sided organ. He used to have boasting a lot, showing his superiority complex, contempting others, giving a lot of advices, although for the welfare of the society and the family or the person before him. uh, Talkativeness was there because he has a lot of ideas. He wanted to share it with everyone. He wanted that the people should obey his advice and all those things. This was what I said, but he was prescribed lycopodium was given by some physicians, but the depth of the things were missed at that time specifically. Why he was boasting, why he was talkativeness, lycopodium, why he boasts lycopodium? Because there is a sense of weakness. Talkativeness is what? Because he want to overcompensate his weakness. ठीक है ना? तो um, this is the differentiating point with sulfur. Sulfur boasting, sulfur talkativeness, and spiritual inclination. Lycopodium reaches the peak point of his spiritual inclination, but the sulfur doesn't reach peak point of his inclination. There is always having lack of perseverance. There's some kind of distance. He cannot focus on one thing. He used to get swept away by some other idea. So depth meditation and all those things are not possible by sulfur personality. He was given lycopodium with after reporterization, but he didn't get avail. No avail was there. Calcarea was given, saying the external appearance of him, winter aggravation of asthma, strong egg desire. Actually, he was having craving for egg. He was not able to take control of his salivation after the sight of the boiled egg. Multiple fears, magnetized desire, afterlife anxiety, all those things, perspiration from his scalp and sour perspiration, etc., was leading the physician towards calcarea car, but it was of no avail. Estramonium was given, partially covered. Stramonium covered him partially uh, over mind symptom with some fear of death, fear of violence, and he used to do violence also. After getting angry, he used to throw the things, break the things, and all. So violence and fear of violence was there. Nightmares also was there. Fear of death was there. Dreams of death was there. The testimony was given, and it was having no avail. After seeing the case, that doctors treated him according to their merits. And what I thought, that I relied on repertory. I usually relied on repertory here also, but in this particular case, the knowledge and application of materia medica guided me towards the remedy. Observation and explanation why the wife was so much helpful. Here, the role of attendant was very, very helping. Mind above the matter was realized when you probe through, when you have the thorough examination of the patient, thorough examination of his constitution, you come towards a conclusion, comes towards an energy field through which the patient is passing through. And that sulfur was selected, and one of the most widely used medicine and the most potent weapon of all the homeopaths. Sulfur is, and king of antipsorics it's called. So on the basis of other salient features and the uh, essence of sulfur was seen in the patient. So what in the nutshell was observed, that the patient was lazy, lazy patient, tired and slow. These kind of patients are not very much extrovert. Usually they avoid company when they get tired. That tiredness is that there is an incapacity to work more, work further, to carry on. So that is that the perseverance is not there. That's why they become slow. Initial strong, steep action, and later on some other ideas will creep in, and the things will, that action will get tailed off, and it will be some other actions. So he will be deterred from one path to another path. Okay? So the patient was very untidy, unwashed. So crippled nail and skin texture and skin. The visibility was, he was looking bright, he was looking very intellectual, but his sense of dressing and his hygienical outer appearance was not that observable, not that pleasantly observable. That was not pleasant, and his wife used to criticize him for that. Ki, why you don't wash your, why don't you brush your teeth daily? Why don't you take bath daily? In the winter season, he will have um, baths after 1 or 2 weeks. In the summer also 1 or 2 days gap will be there. You can imagine about the summer and winter cold and the summer heat in the place like Patna, Gaya or Bihar, you can say overall. Mentally, he was very imaginative. He's a great theorizer, but alternated uh, with a practical ideology and theorizing. Sometimes he used to get very idealistic, and sometimes he used to get very theorizing kinds, very practical and theorizer. So there was an inconstancy of that. He was a very knowledgeable, but he used to get confused due to alternating states. These kind of alternating states, his knowledgeability used to be in the questions. He had a lot of knowledge of so many subjects, but the people observing him were confused. He was very much philosophical about life, death, afterlife, about mankind, religion, and the world, and he was having his own views about that. And but always he has focus missing, depth was missing, because he never tried to reach the peak of the matter. That's why so many achievements he could have got, he didn't achieve. And that might be the problem, that might be the cause why he decided, or it might be the phase why he decided to leave his medical profession to go for some other profession, other medical profession. So there's premature end of any tenure. All kind of his goal were not perfectly achieved. He used to lag behind. You know that the sulfur is called the um, jack of all trades and master of none. We need sulfur in our society. Such a gem for the society, such a knowledge for the society, such an intellect for the society. But he never achieved the peak. He is a kind of all rounder. He had good knowledge of so many things. So, and people can observe that this was due to the disrespect of time. He didn't respect the time, and that's why he lagged behind. But actually, that alternating stage was the matter. He used to get impressed by other kind of impressions, and he started changing his view, changing his goal, changing his path and all. Again, there also, again, he couldn't continue for long, he couldn't persevere for long, and again he can lag behind. So these kind of things went on, kept on going. And egotism was developed. Oh, the sulfur patient, the strong the king of antisoric remedy. These people are having very strong sense of ego and anxiety and the superiority complex. They want to earn a lot of knowledge. They want to earn a lot of um, what we say, money, more than enough money, but not to show that they don't want to become the wealthiest. They have make a limit that this should be the enough money and I should get more than that. No, we can't say that there's some kind of fear of poverty and all. That is not there. So the lack of perseverance was there in his whole life, 30 years age, and lack of perseverance was there. Depth of focus was missing. He was a warm-blooded man. Open-air desire was there. Discharges were offensive. Used to desire sweets a lot. This is the final conclusive points I am giving you. So on which I decided firmly that this is a case of sulfur. Desired sweets, hot drinks, and food. Hot drinks and warm drinks always ameliorates his pain abdomen. Vague symptoms due to frequent use of antibiotics. Antibiotic use was there for the purpose of his pyodermal infections, so many antibiotics, mainly penicillin he got. And during bronchial asthma also, he got many bouts of antibiotics when the thing was very much refractory. Yeah. Huh. So vague symptom was due to that. Antibiotics can change the patient. That you can say it a medicated patient. When you are under influence of antibiotics, it will be uh, bringing about the vague symptoms. So many vague symptoms will be there. So it will not be very clear cut symptoms. And his suppression of pyoderma is already we have discussed. Varicose vein in the legs was very much visible, not very strong, very not very thick, but very definite varicose vein was there. Patient tried to deviate from original course throughout his 30 years life, compelling him to get off the target. Target never achieved the target he desired first, and he never attained the peak. And the peak became impossible. And the sulfurs are very good at that. Multiple distractions or changes in study and occupation. During study time, so many distractions that happened, and now the occupation also. Sometimes you are willing to become a medical officer, then you want to become an IAS officer, you want to have an a sportsman, and you get involved in those subjects and fields also. So how can you focus on that? So sulfur energy field is like that of two ends of pendulum. One is stagnant, and the other is the hyperdynamic turbulent end. And we have to catch the ends also, and in between the ends also. So you have to catch him. So sulfur, which I discussed, I studied him. I called him twice in 2 weeks. And meanwhile I studied because I had not intuition, but I had a definite sight of sulfur inside him, and I wanted to get it confirmed. So because that was on the basis of materia medica. Reportization, I didn't go much in favor of reportization, because reportization is the tool which ultimately leads towards materia medica only. So sulfur LM7, 50 millisievert scale, 7 was transmitted, and he used to be followed monthly. Symptoms vanished. Symptoms just vanished miraculously in the following order. Pain abdomen was gone in 5 days, never recurred. Tenderness of liver, I used to call him every week or so. So, tenderness of liver was gone in 1 month. Respiratory difficulties. Status asthmaticus did not occur. That was the winter time. It did not occur after transmission, after 2 months of transmission. And now 15 years have gone by, and he has no status asthmaticus. Never. He's not having shortness of breath also. Breathlessness on exertion is not there. So he's free from asthma. Non-alcoholic steatic hepatitis, we can say that severe degeneration was never went for biopsy and all again, but ultrasonological follow-up was there. And within 1 year later, he became almost free of fatty liver disease. So fatty liver disease grade 1 was there, and that grade 1 is a very common phenomenon nowadays. So I consider it's very much normal that people are not going for ultrasonography, but grade 1 fatty liver disease is not uncommon. It's very common. People has to live with it. Diabetes gone. The most wonderful thing is the diabetes gone. After 1 year, he was free from diabetes, and now 15 years has gone by. He is free from diabetes. So diabetes, bronchial asthma, pre-cirrhotic stage, all three notoriously incurable diseases were cured by only one potency, LM potency. Meanwhile, I used to do in our transmission, they say that the plusing and strokes I relied on that because the patient was going very smoothly towards cure, towards cure. So this was the case which changed my life. This was the magic which changed my life. It is a true story. Uh, I got convinced. I got the result. I got convinced. I vowed to be a homeopath for my lifetime. I am a homeopath. So many times I struggled with my friends. So many times I quarreled with my friends are allopathy. I am a graduate from Kasturba Medical College, Manipal, and so many of my friends are there in US, England, everywhere, AIMS, everywhere, St. John's. One of my classmates, Anita Mahadevan, is the director of Nimhans also. So many friends are there which fooled me, which ridiculed me that what are you doing? The homeopathy, you should leave it to your wife. She can become a good homeopath. But I got convinced. I tried to follow the path of Hahnemann. So I love homeopathy and I love Hahnemann and all those people who encourage me, who supported me in my practice and my venture. I am always thankful to him. So thank you very much, sir, for giving me opportunity for presentation. I was planning to present some other case, but I had to repeat that Hindi wala case. I had to repeat for the English audience. I don't know how many people are attending the English version of this. I don't know, but any correction, any kind of tips, any kind of question, you can ask me, sir. Yeah. Thank
Thank you, Sivendra sir. Thank you. Thank you. It was really a very informative session.
Yeah.
Now, I request all the participants, if they have any questions or any queries, they can either raise your hand or you can type in chat box. I can see Dhanesh sir
Yes,
raised his. Yes, sir.
yes.
Please.
Thank you, Dr. Suzy, and excellent session, Dr. Sivendra Kharari, sir. I never thought of sulfur in such conditions, but you stick on with the sulfur and the LM potency for seventh potency work for you. What really prefer you to in choosing LM 7 potency, 0/7th potency, or why?
Seven potency, actually, in the beginning, it was on the basis of my intuition. But I had my guru, Dr. M.K. Sahni. He always used to say the maximum, the similimum, and the maximum, the potency. That should be the proportional to the similimum size. The true similimum, the closer to the closest the similimum is, the you can go for the higher potency.
Okay, you just continue with the same potency for a long time, or just for only 1 month, and thereafter you
No,
continue
the
with for
things
a
are
month.
that, yes, sir, yes, sir. The thing is that the patient was going very well. From inside out, he was getting well. And according to the Herring's law, the last symptom was going first, and so it was following very well. The patient was very good from inside. His mind and sleep and his activity all started changing. His positivity started changing. He was ready for the new venture. So I went for the same potency. But I could have changed, but given the requirements, according to scenario only, I was supposed to change.
Okay, thank you very much, sir.
Thank you.
Now, Dr. Hariharan sir raised his hand. The
Not audible.
sir, now Now you can unmute yourself.
Okay, sir, okay, sir. Really, it is a very fine class, and see, you narrated all the constitutional symptoms of sulfur. See,
Actually, yeah.
most of all symptoms you got that from that patient.
Yeah, I had a very deep probing, sir, and the things, some symptoms I just explained, but he was the symptoms what I explained, that was found in that particular patient. He was a that kind of sulfur patient who was carrying this. He was having this.
Most of all, mental symptoms also you got from that
Yes,
patient.
yes.
So typically, he is a ragged philosopher. You explain that.
Yeah,
Typical
ragged philosopher is there.
Okay.
But I have seen a lot of sulfur patient that you cannot say exactly ragged as what I find in my literature and the meaning of ragged. I am not that much convinced, because these kind of sulfur patient, they never go to the depth. They cannot go in depth meditate. They cannot go for meditation. They cannot all persevere in ritualism also. They can't even persist in ritualistic kind of religion. They can't go into the depth of the meditation, so they just lag behind. They had a lot of concepts are so many. So there is no depth. Actually, the here we can say the rags philosopher, or about that, he was not attained completeness. Completeness was missing. So little burst of so many information he is having, so many experiences.
Sir, what about the physical constitution of that patient?
Physical constitution, he was not very thin, not very fat. He was a normal case, about 60 kg person, 5'7" and his hygienic appearance, nails were not crippled and all. His skin was looking a bit dirty when the elbows and all. He was looking a bit unwashed. His face was good. Face was shining, because he had come with some kind of preparation. The sulfur patient, I have seen that the patient is not so much aversion of bath. All the sulfur patients are not having aversion of bath. But when the sulfur patient will think that they are dirty, they will bath 3 or 4 times. They will rub and scrub and do everything to become good, but only thing that their mind, it should get inserted that he is dirty, he is not was. Only thing that he think that he is okay, he's fine, he's neat, so there's no need to take bath. His mindset is like that. So it's not always that the sulfur patient is always dirty and had a strong aversion to bath, but this patient was having a strong aversion to bath. Later on, his father also told that he used to be chased down by his peons and servants to catch him and hold him up and put it in the sink, large tub, to and scrub and wash. So, but it's not like that. This patient also, I remember that told that later on in the adulthood, he started avoiding bath because he used to get his eyes red and all that. The people in the family, they thought that he's taking excuse, but he had but I have seen the patient, the sulfur patient, that they can take bath, they can become very fastidious, because they are having a lot of knowledge, a lot of probing, lot of intellect, so they want to explore the things also. They are also fastidious, and when they think that they are dirty, his house is dirty, he will start cleaning. That I have found in the sulfur, sir. I think you can correct me. You can correct me. Yeah.
Very correct, sir. Sir, once I got a patient like this, like a sulfur, that
Yeah.
one particular thing I noted is that that patient will like the filthy smell.
Fishy smell.
Filthy smell. So
Yeah.
he likes filthy smell. And see, when a filthy smell comes, he's so much attracted to that filthy smell. So when I gave the sulfur, I got other constitutional symptoms and I gave the sulfur, then that symptom is also vanished.
Oh, that's great. That's great.
See, I wondered. See, I read the sulfur completely. I have not seen such a symptom in Materia Medica.
Oh, that's true. That's true. That's great.
Okay,
Now-
sir.
Okay, thank you. Thank
Wonderfully,
you.
it is wonderful presentation, and
Thank you,
really
sir.
it is good. And
Thank
I am really appreciating you, sir. You come with another constitutional medicine curing cases. Okay, it will do good for us. Thank you very much.
Thank you, sir. Thank you. Thank you so much, sir. Thank
Yes.
you.
So now I would like to thank Dr. Sivendra Kharari sir for this well presented case of the sulfur, which covers all the aspects of sulfur patient, and it is really very helpful in our day-to-day practice, and it will help students also to learn all the aspects of sulfur. So hoping this to get more sessions from you on other topics also. So
Thank you.
thank you very much, sir.
Thank you.
And I would like to hand over the session to Malayalam